thank everybody for being here. What a great group. And it's great to be in Seminole County. We're making two big announcements here today. And the first concerns our Department of Health. Obviously, when you're talking about opioid deaths, when you're talking about mental illness, then public health issues like we experienced a couple years ago with the Zika virus, it's very important that we are very active with the Department of Health. So today, I'm pleased to announce that we have identified a leader in the medical profession who's going to be able to lead this charge for us. And so I'm going to be nominating today Dr. Scott Rivkees to be our next Surgeon General and Secretary of the Department of Health. He's an internationally renowned expert on developmental biology and pediatric endocrinology. He's chair of the Department of Pediatrics at the University of Florida College of Medicine and physician-in-chief of UF Health Sands Children's Hospital, part of UF Health, the university's academic health center. He also served as an academic chair of pediatrics at Orlando Health and pediatric chair at Studer Family Children's Hospital at Sacred Heart in Pensacola. His wife, Tina, is here, and then his brother, Peter, and sister-in-law are also here, so we want to welcome you. He's previously served on the faculty of the Yale University School of Medicine, earned his undergraduate degree from Rutgers, medical degree from University of Medicine and Dentistry of New Jersey in 1982, completed residency training and fellowships in pediatrics, pediatric endocrinology, and neuroscience at Harvard Medical School and Massachusetts General Hospital. Prior to joining the University of Florida, he served as a professor and associate chair of pediatrics for research at the Yale University School of Medicine. Also led the department's section on developmental endocrinology and biology and served as director of the Yale Child Health Research Center and the Yale Pediatric Thyroid Center. Currently leads a robust clinical and basic science research program where the key areas of study in his lab are prevention of brain injury in premature infants, among other important things. In 2009, Dr. Rivkees detected a safety problem with a common thyroid medication which was given to 1 in 2,000 children with detrimental and devastating effects such as liver failure and death, and his discovery led to global changes in medical practice. He's a fellow of the American Academy of Pediatrics, has received the George H. Cook Distinguished Alumni Award, has authored more than 200 articles, chapters, and editorials, and developed a research program which, among other things, is focusing on the development of novel pediatric diagnostics and therapeutics. So this is a very, very accomplished guy and has done a lot for our state at the University of Florida. And I think when you're looking at particularly these public health problems like opioids, and I'll be doing another announcement on that shortly, he's the type of guy that I think can make a real difference. So I want to invite Dr. Rivkees up to share a few thoughts with you today.
Thank you. This is an incredibly special day. Governor DeSantis, First Lady DeSantis, Lieutenant Governor Nunes, Secretary Popple, and Attorney General Moody. Florida is an incredibly wonderful and glorious state with natural beauty, prosperity, and most of all, more than 21 million residents. It is the duty of the Department of Health to ensure the health and prosperity of our citizens and visitors, young and old, healthy and infirmed. In my time in Florida, I've seen special health challenges affect our state. We have seen the effects of new illnesses when they suddenly appear, like Zika, and the effects of lingering serious viruses that continue to affect infants and adults, like HIV. We need to ask ourselves, how do we prepare ourselves for the next serious infection, and how do we stop the spread of the current? We have seen the sad effects when brutal hurricanes ravage parts of our state, showing our need for rapid public responsiveness, emergency preparedness, and the value of our public health departments. How do we ensure ourselves that we're even better prepared for the next natural disaster? We've seen the unfortunate rise of opioid-related deaths and the continued growing mental health care problems and the rising rates of suicide. We need to ask, what will it take to fully address these crisis problems? We've seen workforce challenges influence primary care and subspecialty healthcare delivery. This is an issue complicated by our vast geography that spans from urban to rural areas. How do we develop the medical workforce needed for our state? And how do we ensure that our citizens have high-quality health care? I've also had the opportunity to work with the talented and dedicated members of the Department of Health, including those at our public health departments. We have worked together to ensure the very best health care for children with special health care needs and protect and help children from injury and child abuse. How do we continue to build on our successes? Medication safety and the rising costs of drugs are here and now programs. As the governor mentioned, about 10 years ago, I uncovered a hidden safety problem for a medication that had been used to treat overactive thyroids for more than 6 decades, which was causing death and liver failure both in children and adults. Working with the Food and Drug Administrations and the National Institutes of Health, we issued a clarion call, and I'm very proud that no child has died or had a liver transplant in the past decade after this was issued. As the governor mentioned, I'm also a practicing pediatric endocrinologist, and I'm seeing firsthand the soaring costs of essential medications like insulin. Patients should not need to go without medications due to rising costs. We need to ask ourselves, how do we address issues of medication safety and medication costs for the people in our state? Medical marijuana also has proven benefit in several conditions. These include cancer pain, epilepsy, and was legalized in our state in January 2017. Recently, smokable medical marijuana was also signed into law by Governor DeSantis. We need to be sure that these legislative initiatives are implemented promptly and properly. I have spent the last 30 years of my career in academic medicine, including time at Harvard and Yale, and most recently at the University of Florida, where for the last 7 years I've proudly served as chairman of the Department of Pediatrics and physician-in-chief of the University of Florida Health, UF Health, Shands Children's Hospital, which is part of UF Health, the university's academic health center. Along this journey, I have been involved in medical education, physician training, research and discovery. I've had the opportunity to work with medical leaders within the state organizations, the National Institutes of Health. But most importantly, I have always cared for patients, seeing them live and die, and always hoping to make a difference in their lives, and seeing that caring, curing, and hope are a physician's most important gifts. I hope to bring these experiences to the benefits of us all, from infant to elderly, across the state. It is my honor and pleasure to work with Governor DeSantis, Lieutenant Governor Nunes, members of the Agency for Healthcare Administration, the Department of Children and Family Services, other state and federal agencies, our healthcare system providers, and our academic institutions to ensure the health of the state. Lastly, I wish to thank my family for standing with me during my many years of medicine and celebrating this tremendous opportunity ahead. Thank you all.
Well, congrats, well-deserved appointment. The second announcement is, I think, very important and certainly important to people here in Central Florida. You know, substance abuse is a serious public health and safety concern, and the opioid epidemic has devastated families and communities throughout our state. These are issues that require serious, comprehensive action. So today, I'm taking decisive action to address substance abuse in our state's opioid epidemic. First, I'm happy to announce that we have just secured an additional $26 million in federal funds for Florida State Opioid Response Project. That's over and above what we've already received. This project's designed to address the opioid crisis by reducing opioid deaths, preventing opioid abuse among our young people, and increasing recovery services and access to treatment. We will keep to seek funding where we can get it to support programs that work. Today, I'm signing an executive order which takes immediate, concrete, and important steps in prioritizing a statewide substance abuse prevention strategy. First, I'm reestablishing the Office of Drug Control within the Executive Office of the Governor. This office was discontinued several years ago, but the importance of restoring its functions could not be more obvious given the circumstances that are before us. There are many different substance abuse prevention programs under various state agencies. This office will serve to unify those efforts so that we can operate with one clear vision by coordinating and centralizing efforts to prevent and treat substance abuse in our state. Furthermore, the office will coordinate our federal efforts to best leverage our relationships in Washington so that we can receive support and resources that we need. Additionally, the office will be a liaison with our local government partners to ensure collaboration and consistency in our strategy to prevent and treat substance abuse. And we had a great roundtable before this press availability, and what they're doing in Seminole County is impressive. I think the sheriff and the folks involved with public health, have really worked hard. It's a problem that is serious, but I think that it's a problem that they're certainly shown they're up to the challenge. So I think that having a coherent, unified strategy makes sense, and I think this office is a way to do that. I'm also doing today announcing the creation of a statewide task force on opioid drug abuse. A major component of a comprehensive statewide strategy on substance abuse prevention is, of course, fighting Florida's opioid epidemic. So this task force will develop a statewide strategy and identify best practices to combat the opioid epidemic through education, treatment, prevention, enforcement, and recovery. And I note that enforcement is an important part of this. The sheriff had mentioned how some of the people pushing the fentanyl, when those have led to deaths, have been charged with homicide. And I think that that's appropriate when you're knowingly putting something that is almost certain to be fatal in relatively small doses onto the streets. I'm proud to be asking Attorney General Ashley Moody to chair this important task force because of her hard work on this topic, and I know she will guide this important work toward a work product that helps save lives. She is, of course, leading Florida's lawsuit against not just the drug companies, but really people throughout the chain for their role in creating the opioid epidemic. And you may have seen recently in the news that Oklahoma just settled for, I think, $250 million with one of the drug companies. And I've talked to the Attorney General, and that is chump change for Florida. So we are going to work for much more significant recovery, and she's vigorously pursuing that in court, and I applaud her efforts. And so the Office of Drug Control that we're reestablishing is going to support the task force, and it will ensure that when they're making recommendations, that we're implementing that across our state agencies and then in partnership with our local partners. So at this point, I'd like to bring up our great Attorney General to say a few words.
Good morning, and thank you, Governor DeSantis. I am humbled that you would place your trust in me to lead this effort. As many of you know, I am a former federal drug prosecutor. I was a circuit judge for over a decade. I saw firsthand lives and communities that were ravaged by the opioid epidemic. My husband is also a drug enforcement agent. As you can imagine, our dinner conversations and oftentimes our prayers involved those that had fallen prey to this epidemic. Just this morning, here in Seminole County, we lost another victim to opioid overdose death. When I started campaigning to be your Attorney General, we were losing 14 people a day in Florida. From the time it took me to enter this race and become the 38th Attorney General of Florida, we now lose 17 people a day in Florida. And sadly, I expect when our numbers are released for the previous year, we will see those numbers go up. On day one, my office instituted experts from around the state to make up a work group to make suggestions on how we could proceed in Florida to aggressively attack the opioid epidemic. Sheriff Dennis Lima, right here from Hillsborough County, agreed to chair that group. And I will proudly say they made excellent recommendations by the time we started session. As part of those recommendations, they said we need to bring back the Office of Drug Control Policy or have a statewide task force to see what's working, what isn't, how we can attack this in Florida. And Governor DeSantis, as he has done in the short time he has been governor, boldly and decisively did both. And we commend his efforts, and we will show him that we will make progress in Florida. Governor DeSantis has also realized the only way to make progress on the issues we face in Florida is to successfully partner with federal law enforcement agents and providers, local and state providers and law enforcement, and we will do that utilizing this task force. I commend our president, President Trump, who has recognized that this is an emergency. My office has been in communication with the White House on how best to proceed. I also will eternally be grateful to Governor DeSantis for recognizing this emergency, not only promoting this task force, but going after additional resources so that the people involved in this that are fighting it in the trenches on a daily basis have the tools and resources they need, not only to prevent people from becoming addicted, but to go after the drug organizations that seek to harm and poison our children and citizens and help those that are already addicted get the treatment they need. Thank you, Governor DeSantis. It's an honor.